Hello, Sonoma County. Hello, Napa County, and aloha Maui. Welcome to Ask the Expert. I'm Dr. Walter Tom on Ask the Expert on KSRO. Thank you for checking in with us every Thursday from 12:30 to 1 p.m. We love having you there. We have a special guest today. What's your name, young lady?
My name's Bella.
Bella Dabbas. Bella is a great young lady that spent last summer at our office, right? Bella is a first-year nursing student. And where are you a nursing student at?
Gonzaga University.
Gonzaga. And where is that located?
Spokane, Washington.
Spokane. Okay. So my daughter went to UW in Seattle. How's Washington?
I like it. It's a little gloomy, but the spring's coming, so I'm excited.
Okay, do they have good coffee up there?
They have great coffee
They have
up
great
there.
coffee up
Yes.
there. Okay, well, that's great. And of course, we have to say hi to Jeff. How you doing, our producer?
How's it?
Everything's good, Jeff?
Yeah.
Everything's great.
Another day.
All righty, great. Well, again, welcome everybody to Ask the Expert. So, Bella was kind enough. She spent last summer kind of doing an externship with us, and you're in your first year of nursing school.
Yes.
And so she called me and said, "Hey, I'm on break," and she wanted to know if she could come back. And our team loves her, of course. In how many years do you have left before we can try to hire you away?
I have a year and a half left.
Year and a half left,
Yep.
so that'll be about right. We'll be sure to be. They already want me to sign her to a long-term contract, and so we've been dangling that in front of her, trying to get her to come and join our team. So tell me, Bella, you're in nursing school at Gonzaga, and how's school going?
School's going really well. It's hard work, but I enjoy it.
You enjoy it.
I do.
Before you started there, you took a semester off.
Kinda, yeah. I went abroad for a semester in Florence, Italy.
Florence, Italy.
Yes.
Now, what do you mean, kind of?
I still took classes, but they were not directly towards nursing. They were more of GE.
They were what, like Pasta 101?
Kinda, yeah.
Chianti 201.
Yep.
Okay, I understand. So you were in Italy and taking a few classes. That was fun.
Correct.
How is it now coming back and now being in the rigors of school?
It's definitely been a transition, but I've really enjoyed getting to be in a solid schedule and be able to finally apply what I've been learning. Yeah.
Great. Okay, so apply what you've been learning. So when you talk about that in terms of what are you doing now, what are you taking and what are you applying?
I'm currently taking pharmacology, and then also like how you approach a patient, and I'm learning all different assessments. So being able to actually apply it in a clinical setting is very nice.
Isn't that great? Don't you love listening to Bella, all of you out there? That's great. So I'm going to kind of lead you a little bit. What do you like about nursing school?
Everyone's there to learn, and everyone's very eager to learn, and we all work together to be able to do well and succeed.
So you like teamwork?
Yes.
And you like the fact that everybody's sort of eager to learn?
Yes.
Okay, well, you'd be perfect. Okay, here's my contract right here. I got it. Do you mind signing it? I got a pen. I need a pen, Jeff. Anyways, so absolutely, that was the part that I enjoyed about going through my pre-med at the University of Michigan, and I went to medical school in Detroit, and then my 6+ years of residency and fellowship training. And even though it was rigorous, I loved it. It was sort of that hunger for knowledge, which is so great.
Yes.
And so you're finding that in your nursing school at Gonzaga.
Yes, correct.
That's fantastic. And where I would segue with the comment that you just made is that a lot of people now, as we are aging, we're looking for doctors and nurses to take care of us. Okay, nurse practitioners, physician assistants, in traditional medicine as well as in cosmetic medicine and cosmetic surgery. And how do you figure out who to go and see? Right, that's a big question, right?
Yes.
And what I would tell you as you're sort of evaluating people is that you want to look for somebody who has studied hard, is well regarded in their field, and may even be the expert in their field, but who has that hunger for continuing education. Okay, I can tell you, I know the doctors who are going to be the best. I know the nurses who are going to be the best. They're the ones who are still wanting to learn. The ones that are dangerous are the ones who they get done with school, whether it's medical school or nursing school, like, oh, I'm done. I don't need to, I'm done. I don't need to read and all that. I know everything. And they don't even know what they don't know. And so the fact that I love your kind of thirst for knowledge. So I want to applaud you. Way to go there, Bella.
Thank you. Thank you.
That's fantastic. So when you're looking for a cosmetic person, a cosmetic surgeon or cosmetic injector, whether it be a doctor or a nurse, you really want to look for somebody who is knowledgeable, but who also is really hungry, is constantly learning. Bella, we were talking and then I just came back from Licking. I spoke at a national meeting, the American Academy of Cosmetic Surgery meeting, and I was invited to speak there. And here I am. I'm up there talking, and there are people who were my mentors, who are experts, and they're listening and they're taking notes. And I have to say that I was blown away. I was actually speaking at another conference, the California Academy of Cosmetic Surgery, and Dr. Susanna Baggi. And those of you who know about cosmetic medical things know about Dr. Susanna Baggi. She's fairly well renowned and is on the faculty of the University of Pittsburgh. And I remember I was talking about facial fat grafting, and she is somebody who I learned from, her and Dr. Berman, and she's taking notes. And afterwards, she comes up to me and she asked me a few questions about my technique, and I'm answering her kind of very humbly because I learned from her, and she's taking notes on what I'm saying. And I thought to myself, this is why she's such an amazing doctor and why she's an expert and why I'm actually going out to Pittsburgh this summer, and I'm going to learn more about chemical peels and things that she does as a cosmetic dermatologist. Okay, and me being a surgeon, but her being a dermatologist, I have a lot to learn still about skin from her. So that's great. So keep it up. Keep it up. Okay, I love how you are. So now, we didn't bring you on just to talk about your nursing school, although that's really exciting. Well, can we go out for sushi afterwards?
Sounds great.
Okay, and then we'll talk about that. Okay, but for our listening audience, now I do have to ask you, how old are you?
I am 20, going to be 21 very soon.
So you're 20 and a half. Huh?
Yes.
Okay, I'm 70 and a half. How's that sound?
Sounds
okay,
good. Sounds good.
So you're going to be 21 soon. Awesome, that's great. And so are you a Gen Zer?
Yeah, I'm a Gen Zer.
Okay, what's below Gen Zer? I don't even know.
I don't know.
Okay, do you know, Jeff?
I think they're calling them Generation Beta, which is a really unfortunate name.
Generation Beta. Okay, yeah. Okay, so you're a Gen Zer.
Yes.
So tell me, what are some of the cosmetic concerns as you talk to your lady friends, your male friends, and so forth, of your peers, your Gen Zers? What are some of their cosmetic concerns?
Cosmetically, I would say we're starting to be more cautious about our skin and exposure to sun and helping with any of that pigmentation from the sun. Also acne, that's always been kind of a problem, I feel like, and also probably as well hair, laser hair removal, and sometimes talking about lip flips.
Lip flips, okay. Yeah. All right, so well, you just did the whole show, and now we have 20 more minutes that we have to go through. I mean, we kind of set an agenda, and okay. Goodbye, everybody. No, I'm kidding. Okay, so Bella, it's interesting that you say that. A lot of old people, us boomers, those Gen Zers, TikTok, and they're they're dummies and this and that. Man, you guys are really smart. It took us baby boomers decades to learn how to take care of our skin, protect our skin from the environment, particularly the sun. So tell me, I'm kind of a little bit at a loss that the Gen Zers are so, I don't want to say preoccupied because I don't mean that negatively, but they place that, I guess the word would be an emphasis on skin health. Tell me a little bit about that.
Just making sure you're getting sunscreen on, and I feel like your 20s is when you start really taking care of your skin, and that's setting you up for longevity in the future. So,
okay.
Yeah.
Boy, everybody, doesn't she sound smart? Yeah, I know. Just call in. I'll give you her email address so that you can tell her to come and join us in a year and a half. So you are correct, even at a young age, that we can damage our skin. And in fact, we know that sometimes even skin cancers can occur due to sunburns at a very early age. And even places like Australia have sunblock publicly out there for everybody to use because they tend to be more of the lighter skin types there, most of them. And they're out in just this intense sun. So that's really important. So that's really great to hear. In terms of sunblock, so they're trying to avoid that. Is it not cool to be tan?
I love a great tan, but I mean, you can still get color with wearing some sunscreen or a lot of sunscreen.
You are very wise. Okay, I know. I mean, that we all wanted to be, I wanted to be a blonde hair, blue eyed, beach boy living in Michigan and wanted to be in California. Couldn't do that. So, of course, then I thought, okay, I got to look Hawaiian. So I was always trying to be tan,
Yeah.
and look like a Hawaiian. And so that wasn't very smart or very healthy. So that's really great. So, what I would say for the Gen Z is that when you apply sunblock, you want to apply it not just on your face, but all over, number one, because one day you're looking and you got great legs and arms, skin and everything. And then the next day you wake up and you're like, oh my God, where did that happen? And let me tell you, it happens all of a sudden. Bella, my patients would say that to me and I'd think, what are you talking about? This takes time. And now that I've passed their age, they're absolutely right. It just one day you wake up and you go, whoa, look at this. So prevention is huge, and it's one of the least expensive things you can do. So what you put on your skin and in terms of your body, I'm going to tell you that it's important when you look at sunblock, try to get eco-friendly sunblock, number one, that doesn't hurt the reefs, okay, especially if you're in water, beach areas. But the other thing is that you want to use mineral sunblock. So do you know what those minerals are? I'll put you on the spot.
I do not.
Okay,
No.
the zinc. Yeah,
Okay,
you knew that. So
yeah,
look how
zinc.
smart you are. So zinc oxide and titanium dioxide. So now you're going to remember that.
Yep.
Okay, I got you on the air. Sorry, Bella. But zinc oxide and titanium dioxide. And so those are actual physical mineral blockage, okay? And so they're healthier for your skin for breathing and causing less allergic reactions, as well as a better block of the sun, okay? So the key is to use those type of products and to put them on 2 or 3 times during the day minimum, okay? So that's something they have to be reapplied. When we do it for the face, that's where I'm going to tell you, because, we're all trying to save a few dollars, right? So we go to the local drugstore. Okay, what was that, Dr. Tom? And I'm not going to mention the brand name, but, you said titanium dioxide, zinc oxide, they're kind of looking for that in the products. Problem with a lot of those over-the-counter, if you will, sunblocks for the body, work great on the body, but our skin of our face is just a lot more sensitive. And so breakouts can occur. So I would tell you to spend a little bit more money getting medical grade sunblock. Okay, of course, that's what we carry in our office. But that's important to use because that will help to keep your face from getting clogged, pores getting clogged and all. Okay, so when you mentioned you ran through the entire show in 30 seconds, which was very good. So we were talking about skincare for the Gen Zers. It's great that they're looking at health. What I think you mentioned acne. Okay,
yes,
so
correct.
so you're coming out of high school, college, and beyond, and acne is still a problem. What kind of treatments do you see your peers doing? Whether good or not.
I would say just trying to find different treatments that aren't helping or like topical, but nothing that's like proven to help. But I've also, like we've talked about, that you supply is microneedling to actually help, which I know I have a couple peers that have tried that.
Okay, alrighty. So we'll say that microneedling, we're going to come back to that. So you mentioned products, and I know when we were in the office and you were a little shocked when I said, I'm going to bring you on the air, and the staff was all laughing, and we were talking about what we were going to cover.
Yes.
I asked you about that, and one of the concerns that you told me the Gen Zers have is what skincare product to find, what's right for them, that they have a hard time finding that, right?
Yeah.
So, a lot of times social media can be great, but that's one of those things where you should go and talk to a professional, somebody who specializes in skin care and who's a good student. Remember, we talked about that, so that they know that they can follow through with you. I mean, there's nothing wrong. We all buy things online, but go somewhere where you can get some products that they're going to stand by the products. They understand the science of the product, and they've evaluated your skin, because your skin is very different from my skin, right? And so I would recommend something different for you, Bella. And what I would say is you add one product at a time, okay? I know when I was 18 or 19 and had acne, I wanted everything, right? And give me a gallon of it. Don't give me that 2-ounce tube. I want a gallon of this. But it's to kind of hold your hand, help you find out what the products are that might work best for acne, or even if it's not acne, you may have redness or inflamed skin, sensitive skin. You may already beginning to see pigment changes, okay, especially people of color at an early age, we can see that, melasma. So find somebody who can help you and take you step by step, and that's the way to go. Not so much in, peers are great, they can help to guide us through the intricacies of life, but when they tell you what they've used may not be what's right for you.
Correct.
So find a specialist who can help you. You talked about acne, and so as you move from the 16, or I should probably say 12 years old, all the way through 19-year-old, that's usually when we get hit hardest with acne, and some people tend to get acne scarring. It can be very disconcerting, right? I mean, who likes acne? We all, when we get a zit that's probably only a millimeter size, when we walk in a room, we think it's the size of a basketball, right? And everybody's looking at it, right? Oh my God, look at, I got this zit on the side of my nose, and everybody's looking at it. And then when we start to get scarring, that's very disconcerting. One thing that I would say, Bella, is that what I would encourage you, and if you're young enough that you're living with your parents, or your parents are part of your support system, is try to get in early for that. Don't sort of wait that out, because if we can get involved earlier with patients who are more prone to acne scarring, we can help them, because once you get the acne scarring, it's a lot harder to deal with. So you mentioned microneedling. Can you tell us about microneedling?
A little bit. I know it's helping with resurfacing some of the skin, and promotes the cell regrowth and stuff. Yeah.
Right. Okay. Yeah. You did it. That was pretty good. Okay. I put her more. I've been putting her on the spot a little bit here, but I love the way that you have just coming and volunteering your time with us. How you've learned this. So you notice that the staff, the nurses, or the medical assistant, first thing we do is have the patient wash their face, of course, and then we have them put on a topical anesthetic, right?
Yes,
so they put on lidocaine. So they're putting on a topical lidocaine, which is an anesthetic to numb them up, and then we remove that, and then they take a pen that has about 20 plus little needles, and then kind of they go over the skin, and they create these little tunnels. Yes. Okay. Do you play golf?
I do not play golf.
Neither do I. Not very well. Maybe once a year I play. Okay. Have you ever seen a lawn that's been aerated?
Yes, I have.
You have?
I have.
Okay, so you've seen how the lawn's been aerated. So basically, that's what microneedling is doing. Okay, so you're aerating the skin, if you will, and causing these little tunnels. Okay, and so if nature is good to us on your lawn, what happens? You get new, fresh, green grass growing in those holes, right? And it's the same thing with microneedling on the face, where we cause these little tunnels, and if nature is good to you, then you begin to create new cells in there. We can also use it over scars, and that's what you were referring to. You stole all my thunder immediately in 30 seconds, but using the microneedling can be used on scars to soften scars. They won't necessarily make them disappear, but they can certainly soften them. Okay, and so that's microneedling, and it's a pretty comfortable treatment because of the topical. Have you seen any of those treatments?
Yes, I have.
You have. Yes. Okay, and did you work with Jessica or Mary or both of them?
It was both of them.
With both of them. Yes. Okay. What would you say you noticed the most when somebody had a microneedling treatment? What stands out?
What stands out? Probably I don't know. I'm actually not sure. I'm trying to think.
Okay. Was it the serum that they put on there?
Yes.
Okay.
Yes.
All right. Good. All righty. See, so, okay, we're going to send you back to Gonzaga, but I'm still signing you up for a year and a half from now to join us. Okay. So when we do the microneedling, we're aerating the skin, as we mentioned, and then we draw off some blood, and we take the serum off the blood that is high in platelet-rich plasma. And those are you might have heard me talk about it, they're the paramedics of the body. And so we activate it, and so it goes from PRP, or platelet-rich plasma, to platelet-rich fibrin, and it helps to stimulate the bioregenerative aspects. And so what we do is we place it on the skin, and it soaks in through those little holes that we've made with the microneedling, and it helps to facilitate the healing. So that's microneedling with PRP or PRF. So thank you for bringing that up. So tell me about the Gen Zers, what are they thinking about a lip flip? I
Yeah.
look, you got great lips.
Oh, thank
want-
you.
Did you
I
want-
don't.
You
I
do
don't
it? Okay.
personally.
Okay.
No.
All right. Okay. So
No.
so tell me what is the trend? Is that
I
something
just
on
think,
TikTok?
I mean, I don't know. I'm currently not on TikTok because of
Uh-huh.
school, but
Okay.
some of my friends, like, I just want to have more of a flip so their gums aren't showing as much in their teeth. So I
Okay.
think
Okay.
they've heard of lip flips, but not
Okay.
really educated on it.
All right,
Yeah.
so lip flips are big for the Gen Zers. So what is that for us old people? Okay, what is a lip flip? So what we do is there's a muscle that goes all around our mouth, which is our lips, and that's called the orbicularis. The orbicularis oris. You were going to correct me. Go ahead, correct me.
No, it's okay.
I always said oculi, which would have been the eye, right? So thank you for keeping me honest. Okay, so Bella, the orbicularis oris, which goes around the mouth. Okay. And so by injecting the top part of the lip with a little bit of Botox or Dysport, it can cause a relaxing of some of the muscles, the insertions in the orbicularis oculi, and then cause it to kind of flip up so they get more of a pout.
Yes.
Right.
Yes.
Okay. And so that can work very well, and it can give a really nice lip flip. And I know that Karina, who's frequently one of the guests on our show, who's our medical assistant, surgical liaison, that's what she likes to do. I mean, she's a beautiful young lady. She's in her mid-20s and looks beautiful. But that is one of the things that she likes to do is a little Botox to give her a little bit of lip flip. And she's got Latina lips and gets that. Okay. So that can work very well. One thing that we do have to advise or caution the patients about, Bella, is that sometimes it can make it a little bit harder to whistle. So if you whistle for a living or you play an oboe or the flute, we probably shouldn't do a lip flip on you, or sucking on a straw. So if you like, milkshakes and those kind of things, it's going to be harder to suck on a straw. So we have to make people be aware of that. So those are lip flips. And then you said hair removal.
Yes.
That's a big thing.
Yes.
Okay. Are you talking about the face, talking about the body?
I would say more of body. Yeah,
Okay.
body.
And so why are they interested in laser hair removal versus the shaving?
Time, maintenance. It's just we've all seen great results from other peers, and just saves time.
So so for you as a young Gen Zer, it saves time. I do know that some women complain, and men actually, in the beard area of ingrown hairs.
Correct.
And especially in the bikini areas when ladies decide to go out to the beach or on vacation, and that they can get very irritated from shaving or even the depilatory topicals that they used for hair removal. So laser hair removal is great for that, and for men for ingrown hair. And then, of course, on the body, that could be a big thing as well. Bella, thank you for coming here. I'm sorry, I know I put you on the spot a little bit, but you did great. And I can tell that you already, just in the very first part of your nursing career, how much you've learned, which is really amazing. And would you come back?
Yes.
Okay, so thank you. So Bella here, first year nursing student in Gonzaga, visiting us. Someday we're going to have her come and join us in another year and a half. We talk about Gen Zers, their concerns, and we love the fact that they are definitely into skincare, sunblock, microneedling for acne. They like the lip flip, and we do all of those at Dr. Tom's Cosmetic Surgery, as well as laser hair removal. So thank you all, and thank you for giving me the liberty of inviting Bella to our show today. Thank you, and we will see you next week.
You've been listening to Dr. Tom of Dr. Tom Cosmetics.